Hello friends, welcome back to my channel Medicine of Zero. Today we'll talk about the management of angina pectoris. Okay, so before starting the topic, let's define the term. What do we mean by angina pectoris? So as we know that the heart that will pump the blood within the different regions, especially along with the what with the heart muscles, right? So whenever the heart is not able to pump the blood within the heart muscles, as a result, we will see the deficiency of blood within the heart muscles. So whenever the deficiency of the blood within the muscle, especially if we just talk about in terms of the myocardium, so try to understand whenever this heart is not able to pump the blood, so pumping of blood that is not sufficient, for example, or less. As a result, the heart muscles there will be also the deficiency of the blood. So whenever the deficiency of the blood, definitely there will be also a deficiency of oxygen. So whenever we will get the deficiency of the oxygen, there will be deficiency of what? Deficiency of ATP. So whenever the deficiency of the ATP, definitely these muscles they will be not able to contract properly. Alright. So whenever they will be not able to contract properly, as a result we will get the dysfunctions of the myocardium. Right. Now, why we will get the development of angina? The etiology, as far as the etiology is concerned, what type of the etiologies we can get over here? Now, on the basis of the etiology, you can classify angina in the two types. One is the classical angina, another is known as variant angina. Okay. So, if I just write it over here, I'm just taking this is the classical one. The classical angina pectoris is the variant angina pectoris. Another name for it, you can remember French metal angina pectoris, or you can remember vasospastic angina pectoris. What are the thing we'll get in terms of the classical angina pectoris? Let's talk about that thing first. So in these cases, we'll get the depositions of fibrofatty plaque within the branch of the coronary arteries, right? We'll get the deposition of fibrofatty plaque. Now see, whenever you're getting the depositions of the fibrofatty plaque, for example over here, or we can say in the better way, we can say in terms of the atherosclerosis. Atherosclerosis. For that thing, we'll get the deposition of fibrofatty plaque. Fibrofatty plaque, where within the branches of the coronary arteries. Now, whenever you are getting the depositions of fibrofatty plaque within the branches of the coronary artery, definitely the blood flow that will be obstructed over here. In the same way, for example, if I just take also over here the depositions of the fibrofatty plaque. Okay. Now see, definitely the blood flow that will be inhibited, or you can say the sufficient blood, okay, that will be not able to reach over here within the muscles. As a result, we will get the development of the infarctions over here. Okay. Now see, in terms of the classical angina, we will see there will be no chest pain. Why will not get no chest pain? Here we will not get the chest pain normally under resting condition. Under or resting condition. Now try to understand whenever we see the development of the or depositions of the fibrofatty plaque, the endothelial cellular linings, the endothelial cells, whenever we get the development of the ischemia within these regions, the endothelial cells they will start releasing what? Nitric oxide. So from here, from the endothelial cellular linings, we will get the releasing of nitric oxide. And the nitric oxide, what they will do? They will cause the vasodilations. As we know, the nitric oxide as the vasodilator. So they will cause the vasodilation. So whenever they are causing the vasodilations, as a result, we will see. For example, we will get in this way. Whenever we get the vasodilations, now some amount of the blood, okay, they will be able to reach from the main branch to the from the main artery to the other branches of the coronary artery. So from here, for example, if I show, whenever it will be dilated, whenever we are getting the dilation of the coronary artery branches over here, as a result, we will see the blood that will be able to reach from these regions to the muscles. Okay, that's the normal thing. Now, for example, whenever the individual is doing exercise, whenever the individual who is having the classical angina pectoris is doing exercise, as a result, we will get whenever the individual is doing exercise, there is the normal thing that our muscle needs more amount of the oxygen. Now, for just to get the more amount of the oxygen, try to understand definitely there should be more amount of the blood. more amount of blood. But see, whenever the individual is doing exercise, already we are getting on the resting conditions, already the what? Already the branches of the coronary artery dilated maximally. But after that, whenever the individual will do exercise, further we cannot get the dilation of the coronary artery. So as a result, we will get, in these cases, the deficiency of blood. Instead of that, we can say the deficiency of oxygen within these regions. So during resting conditions, we will get the dilations of the coronary artery branches. As a result, the individual will not feel any kind of the pain. But whenever the individual will do the exercise, or at that time, for example, he is walking fast or he is just running at the time, we will see the muscles demand for the oxygen that will be increased, but it is maximally dilated. Further, we cannot get the dilation of the coronary artery branches. As a result, we will get the deficiency of the oxygen at the muscular level. Okay. Now, as far as the treatment is concerned, or the management is concerned over here, how can we just treat this patient? One thing, okay, let's write it over here. As far as the treatment is concerned, one thing we can do, we can just decrease the work of the heart. Decrease the work of the heart. Whenever the work of the heart that will be decreased, the demand for the oxygen that will be also decreased over here. It's basic things. Okay. Now, okay, let's use it over here. Okay, it's and the second thing we can do over here, we can increase the blood supply. We can increase the blood supply. But then the second thing is over here, it's not possible. Why? Try to understand. It's already dilated mediums of the nitric oxide over that will be secreted or released by the endothelial cellular linings. But we can do one thing in these cases. We can decrease the work of the heart by using the different kinds of the drugs. And as the drug is concerned, whatever the drugs we are going to use over here, first we can use the nitrate group of the drugs. I'll tell all the mechanisms. Okay. Second, we can use the beta blocker. We can use the potassium channel opener. Okay. Potassium opener. I'll talk in details for each individual's mechanisms. It will be easier for you to understand them. Okay. Before that, let's talk about the variant angina pectoris. It's also known as what? Unstable angina. And this is the classical angina pectoris. This is also known as stable angina. It is also known as fringe metal angina pectoris or vasospastic angina pectoris. Now, in this case, what are the thing we'll see in the main branch of the coronary artery? Main branch of the coronary artery here, from these two linings, it's easy to understand. We'll get the vasospasms. In these cases, we'll get the vasospasms. So whenever we are getting the vasospasms, so the vasoconstriction. Okay, try to understand. Definitely the lumen. We are getting the lumen, that will be, we'll get the narrow lumen. That will be narrow. As a result, whenever the lumen, that will be narrow. In these cases, under resting conditions, also the patients will feel pain, chest pain. The patient will feel chest pain. Now see, whenever you are getting the spasms, whenever you are getting the vasospasms, okay, under resting conditions also we see this type of thing. As a result, during the resting conditions also we'll see the the blood supply that will be not enough within the muscular regions. So in these cases we'll get the chest pain. The chest pain always will get chest pain always. But in case of the classical angina, or you can say rather the stable angina, in these cases we will feel the chest pain only during exercise. Okay, whenever the demand of the whenever the demand for the muscles, the oxygen demand that will be increased. In these cases we'll get in terms of the classical angina. But in case of the variant angina, we'll get always the chest. Okay. So in these cases we should go for the drugs. Okay. Now at first we'll talk about, okay, before that let's talk about that thing, then I think it will be easier for you. Okay, now we'll talk about the drugs. So at first I'm just discussing about the mechanisms of the nitrate group of the drugs, how the nitrate drugs they work over here. Okay. So first I'll write it over mechanism of actions for the nitrate group of the drugs. Okay, mechanism of nitrate. Now whenever we are using the nitrate, try to understand, whenever we are using the nitrate, this nitrate will be metabolized by the what? Aldehyde dehydrogenase enzyme. aldehyde dehydrogenase enzyme, and as a result we will get the productions of what? Nitric oxide. We get NO. Okay, we get NO. Now this nitric oxide that can activates the guanylyl cyclase. Guanylyl cyclase. So whenever the guanylyl cyclase that will be activated by the action of the nitric oxide, what it will do? It will convert the ATP into cyclic GMP. Try to understand. At first we just use the nitrates. These nitrates that will be metabolized by the aldehyde dehydrogenase, and the nitrate that will be converted into nitric oxide. And this nitric oxide is having the capacity to activate the guanylyl cyclase enzyme. Okay, and this guanylyl cyclase, what it will do? It will convert the ATP into cyclic GMP. So it is having the capacity to convert the ATP into cyclic GMP. And this activate another protein that is known as protein kinase G. Protein kinase G, and whenever the protein kinase G that will be activated, what it will do? It will inhibit the function of, okay, it will inhibit, okay, let's write it here. It will inhibit the function of myosin light chain kinase, another enzyme. Okay, and whenever the myosin light chain kinase, this activity will be inhibited, we will get the smooth muscles relaxations. We will get the relaxations of the smooth muscles, or relaxation of smooth muscles of the blood vessels. Okay. Now, whenever we will get the relaxations of smooth muscles, definitely try to understand we will get what? The vasodilation. We will get vasodilation. So, whenever we are getting the vasodilations, definitely more amount of the blood will be within the cardiac muscles in terms of the myocardium. And these vasodilations that will cause the what? Hypotension, the blood pressure that will fall. Once again, what did I say? That as far as the treatment is concerned, I have already explained you. We can use drugs, we can use the calcium channel blocker, we can use the beta blockers, and you can also use the calcium channel opener. Okay, sorry, the potassium channel opener. Okay. Now, first, so what it is in terms of the nitrate group of the drugs, the mechanism of actions for the nitrate group of the drugs. Whenever we are using the nitrates, this nitrate that will be metabolized by the aldehyde dehydrogenase. Okay, this aldehyde dehydrogenase enzyme that is present within the cytoplasm and mitochondria. Okay, now whenever the nitrate that will be converted into nitric oxide by the action of aldehyde dehydrogenase, this nitric oxide that can activate the guanylyl cyclase enzyme, and whenever the guanylyl cyclase that will be activated, that can convert the ATP into cyclic GMP. This cyclic GMP that can activate phosphokinase G. Okay, or you can say the protein kinase G over here, and that can inhibit one more enzyme that is known as myosin light chain. So whenever the myosin light chain kinase that will be inhibited, we will get the relaxations of the smooth muscles. As a result, we will get the vasodilations. Ultimately, we will get the blood pressure that will fall down. Okay. What are the drugs we will get under the nitrate groups? Okay. Before that, one more thing, you should remember that the nitrates, they are veins. The nitrate group of the drugs work on the veins, because the enzyme, we are getting the enzyme, the aldehyde dehydrogenase, that is mainly present within the veins. You can say the enzyme aldehyde dehydrogenase. Okay, let me use this one over here. Aldehyde dehydrogenase, this enzyme that is mainly present within the vein and the arteries. So that's why we'll get the more actions of aldehyde dehydrogenase. Now see, whenever we get the, try to understand, whenever we are getting the vasodilations within the veins, so ultimately whenever the veins will be vasodilated over here, definitely the preload that will be decreased. Try to understand, because we know that the veins that connects the blood from the different tissues to the heart, as a result, we will get the vasodilation. So the preload that will be decreased over here. Okay, this is the thing. Now, as far as the enzyme, what did I say over here? That aldehyde dehydrogenase, This enzyme is present within the cytoplasm. Along with that, it is also present within the mitochondria. Most of the drugs under the nitrate group, they will be metabolized by the aldehyde dehydrogenase enzyme that is present within the cytoplasm. The most of the drugs, almost all drugs we can say rather, metabolized by aldehyde dehydrogenase enzyme that is present within the cytoplasm. Okay. Only one drug is over here, glycerol trinitrate. This drug will be metabolized by aldehyde dehydrogenase enzyme. This enzyme that is present within the mitochondria. So what did I say you? That the enzyme, okay, we can say over here, the LD, ALD, that means we can say in terms of the aldehyde dehydrogenase. So the aldehyde dehydrogenase that will metabolize the nitrate group of the drugs, this LD, ALD, or you can say the aldehyde dehydrogenase that is present within the cytoplasms as well as within the mitochondria of the cells. So most of the drugs, rather we can say almost all drugs, that will be metabolized by this enzyme, okay, the aldehyde dehydrogenase that is present within the cytoplasm. Only the drug, we can say over here, that glycerol trinitrate, that will be metabolized by the enzyme aldehyde dehydrogenase that is present within the mitochondria. Hope it's clear for you? Okay. Now we'll go back to the drugs. What are the drugs we'll get under the nitrate groups? For that thing, let's from here. So the drugs of nitrate group. Okay. So we'll get fast the glycerol trinitrate, or you can say GTN over here. The brief forms, the short form you can use the GTN over here. The second you can use isosorbide dinitrate. Now see, these two drugs can be used through the sublingual route. So the what? Glycerol trinitrate, along with that the isosorbide dinitrate, these two drugs can be used through the sublingual route. Okay, nitrate groups. The other group of the drugs you can get, okay, isosorbide nitrate. We can also get the amyl nitrite. We can use over here. Okay, let's use this one over here. Amyl nitrite. The amyl nitrite, this is the shortest acting drug. Okay, shortest acting drug, and it is used through the inhalation route. When we were talking in terms of the drugs of the nitrate group over here, at first I just did mention about the glycerol trinitrate along with the isosorbide dinitrate. These two drugs, okay, they can be used through the sublingual routes. Apart from that, whenever I just did mention of this on the amyl nitrite, this is the shortest acting drug under the nitrate groups, and you can also use the isosorbide mononitrate over here. Okay, and this drug is having the specialty, it is having the least, or you can say the minimum fast metabolism. It is having the minimum fast metabolism. Minimum fast metabolism. Okay, this drug. Okay. One more important thing, that the nitrate group of the drug, they shouldn't be given with the sildenafil. Okay, let me write it over there. I think I have to erase some portions from here. Then I can get this space. Okay. See, what did I say you? So sildenafil drugs that is used basically what that can inhibit the phosphodiesterase 5 enzyme. Okay, the sildenafil that can inhibit the phosphodiesterase 5 enzyme. But why we are not supposed to use the sildenafil along with the nitrate group of the drugs? The reason is over here. As we know, the nitrate group of the drugs, they can activate the guanylyl cyclase, and that will convert the ATP into cyclic AMP. As we know, it will convert the ATP into cyclic GMP. What it will do, the sildenafil drugs, it will come over here and it will inhibit the phosphodiesterase enzyme over here. So whenever this enzyme will be inhibited, as a result, whenever the phosphodiesterase enzyme will be inhibited over here, try to understand the cyclic GMP, the breakdown of the cyclic GMP, the breakdown of cyclic GMP, that will be also inhibited. As a result, the concentrations of cyclic GMP that will be increased severely. Cyclic GMP that will be increased so much. As a result, as I said, you will get the vasodilatations when you are getting the cyclic GMP that will activate the protein kinase G. As a result, you will get the ultimately you will get the vasodilations. So whenever you will get the severe vasodilations, as a result, we will get the severe hypotension. Severe hypotension. That's why you want to use the sildenafil along with the nitrate group of the drugs. Okay. So this was the first part in terms of the management of angina pectoris. In the second part, we will talk about the calcium channel blockers, potassium channel openers. Okay. In terms of the calcium channel openers, the two types of these things over there. And right now I can just say about the uses of the nitrate group of the drugs. So as far as the using of the nitrate group of the drugs, you can remember at first. Okay, to here in terms of the uses, so you can use in terms of the angina first. In terms of the, we can use in terms of the biliary colics, biliary colic. Okay, let's use it over here. We can use in terms of the cyanide poisoning also. Try to understand. I already explained you the basic pathology, that whenever we get the formation of the methemoglobin, within the methemoglobin there is a chances for the formations of the, in these cases we will get the cyanide for using the sodium nitroprusside drugs. For example, we are using the sodium nitroprusside drugs for a long time in terms of the hypertension, as you know, is the emergence drugs in terms of the hypertension. Sodium nitroprusside, for example, sodium thiosulfate. Okay, in these cases we can get as a byproduct, we can get the cyanide, and this cyanide that can do the dysfunction of oxidase, citrate, citrate. As a result, we will get the dysfunctions within the mitochondria. So whenever we get the dysfunctions within the mitochondria, cytochrome oxidase, the cytochrome oxidase that will be dysfunctional over here. So ultimately, I will not get the proper. So whenever the ATP will not get, the cell can survive. The cell can't. To treat these things, we can use the nitrate group of the drugs, and ultimately we have using, and that will be converted ultimately into the cyanocobalamin, and it can be excreted easily through the urine, so there will be no problem. Okay, in these cases we can also use the nitrate group of the drugs in terms of the myocardial infarctions. We can also use in terms of the congestive heart failure. Okay, and we can also use in terms of the esophageal spasms. Whenever we can get the esophageal spasms, and in these cases we can also use what? In that cases we can also use the of the drugs. Now, before finishing the video, let me tell you one thing, that just remember these things very quickly, because I think if these questions came on FMG 2021, most probably, that which of the following drugs that can be metabolized by the aldehyde dehydrogenase that is present within the mitochondria in terms of the drugs. Then you have to remember over here that the glycerol trinitrate drugs. Okay, in these cases. So the mechanism is very simple. Okay, the nitrate, when you are using the nitrate, this nitrate that will be metabolized by the aldehyde dehydrogenase. So nitrate that will be metabolized by aldehyde dehydrogenase. It will be converted into nitric oxide. This nitric oxide that can activate the guanylyl cyclase, that will convert the ATP into cyclic GMP. The cyclic GMP that can activate the protein kinase G, and this protein kinase G that will inhibit the myosin light kinase. As a result, we will get the relaxation of the smooth muscles. Ultimately, we will get the vasodilatations. So ultimately, we will get hypotension. The blood pressure that will fall down is the normal thing. Okay, see you in the next video. Thanks for watching. And if you don't subscribe till now, please do subscribe. Thanks for watching.